Hi, everyone. Welcome to this month's Missouri Open Door Benefit Series. This month, we'll be discussing home and community-based services, so it'll be an HCBS summary. We have two fantastic presenters from the Division of Senior and Disability Services, Rena Cox and Jana Anderson. They will share information around the 6 Medicaid waivers that their organization operates, including eligibility requirements and an array of services available. This series is sponsored by the Medicare Improvement for Patients and Provider Act, also known as MIPA. It's sponsored by all 3 priorities, 1, 2, and 3. And that's Missouri SHIP, the State Health Insurance Assistance Program, Missouri Department of Health and Senior Services, and UMKC, the Institute for Human Development, University Center on Excellence in Developmental Disabilities. Advance. The No Wrong Door, this is the Missouri No Wrong Door activity. And what that is it's transforming the way people access services in their community, support individuals and caregivers to make decisions on complete and accurate information about the options for anyone seeking long-term services and supports regardless of age, income, or disability. And that's supported by the Administration of Community Living. So just to share a little bit about this series and the way it's structured, it's opening doors to integrated supports. We have 2 different series that we run monthly, and we call those the monthly open door series. There's one on technology, and then today's is all around the green eligibility specific portion of the integrated support star, and it's the Missouri Open Door Benefit Series. So that's around eligibility specific needs-based services based on age, geography, income level, employment status, government paid services based on disability or diagnosis, special education, or Medicaid. Those are the type of things we discuss on this series. Advance. So I'm going to pass it over to Rena so that she can share more about the survey and needs assessment for the master plan on aging and the statewide needs assessment. And she can also share her great information. Rena does have a lot of information to share, and she's going to have the support of her colleague, Jana Anderson. Because of that, we're going to hold the questions until the end, and they will be happy to answer questions once they get through the bulk of their material.
All right, I'm giving everybody feeling like on a carousel wheel today, aren't we? Hi, everyone. I'm Rena Cox. I'm going to turn my camera on for just a minute just so I can say hi and everybody can see who I am. Unfortunately, we've been having some server issues, and I don't want to have any freezing problems with my audio, so I'm not going to have my camera running most of the time. As Colette has said, there's a lot of information here. I'm going to try to get through this as quickly as I can, but trying to make sure I give you as much information as possible. So it's kind of a fine line right there. So I am going to talk about services that the Division of Senior and Disability Services provides. Like we do have our state plan services and our 1915C waivers that we provide. And so I'm going to go over those and just give you a brief overview. So when it comes to our state plan services, those services are both agency model and our consumer directed services. And then our waivers that we have, we oversee the age and disabled waiver, the adult daycare waiver, the independent living waiver, the structured family caregiver waiver, and the adult brain injury waiver. We also oversee the medically fragile adult waiver that is in a different area of my division than what I actually oversee, but I'm going to give you some information about that so you have a basic knowledge of the medically fragile adult waiver. So let's first talk about our agency model services. That is our state plan services. So anybody over the age of 18 qualifies for these services. They do have to have active Medicaid and with an appropriate Medicaid eligibility code. So basically that means whatever Medicaid they have from Family Support Division has to be able to be reimbursed for these services. When we're talking about active Medicaid, when somebody has a spin down, which is a premium, I'm sure everybody here knows what that is, but if not, just a spin down means they make more than the maximum amount for Medicaid, which means they have to pay a premium monthly in order to access their Medicaid benefits. So our services, if that spin down has not been met, they can't receive these services until that spin down has been met and the provider can get reimbursed for those services. They also have to meet nursing home level of care. Some individuals out there might be aware that we're doing some transformation when it comes to our level of care. Right now, we actually have 2 level of cares that we're operating under. Coming October 1st, we will only be operating under our newest level of care. So we will only have 1 level of care as of that date. And, if there's questions about that, you can feel free to reach out to us as an agency, to our LTSS at health.mo.gov, and that we can answer questions that you might have about the level of care. So with our agency model, we have basic personal care services. Basic personal care services assist with dietary, which can help with cooking a meal. It can help with feeding. It can help with cutting up items. We help with dressing and grooming. So that would be helping them actually get dressed in the day, brushing their teeth, brushing their hair, doing their hair, things that they just need to get their day going. We help with bathing to include washing the back, washing the hair, the whole bathing as well. We can help them with setting them to get in and out of a bathtub. We can help them with setting everything up, like getting the towels and the shampoo and all of that together. And anything that really constitutes the bathing task. As you notice, I'm kind of talking, the services we're providing under here, it's going to be hands-on assistance. So there's not a lot of wait time that we're doing with it, but we are making sure that they're getting those hands-on assistance completed. We also aren't doing any services that would be like for educating or prompting and cueing. So we can remind them, hey, we need to go take a bath, but the task itself is actually helping with the bathing task and not the prompting and cueing. If somebody needs help with prompting and cueing, that we may look to see if Department of Mental Health is a better fit for them for services. We have toileting and continence. So, helping them with any part of the toileting task, making sure they get to and from the bathroom. If they have an accident, helping them clean up. With mobility and transfer, that's helping them get from one place to another. When it comes to this, we can't deadlift somebody, so they have to be able to bear their own weight, at least bear their own weight and pivot transfer. So maybe they can get some help with standing up, but they can bear their weight while somebody turns them to get them into a wheelchair. Under basic personal care, we're able to do that. But if they cannot bear their own weight, we could not assist them under basic personal care to help them with their transfers. Self-administration of medications. This is somebody saying, I need to take some medicine. So we bring them their pill bottle or their pill box, and they put it into their hands, and we might help steady their hand to get the pill to their mouth. We may help steady their hand to get the water there, but we can't touch the medication itself. So they have to be able to actually get it into their mouth and whatever mechanism that they use to do that. Also, you'll see medically related household tasks. Those are those house cleaning tasks that I'm going to talk about under an age and disabled waiver. With the medically related household tasks, that's where we can make sure that their homes are clean and able for them to stay there and not pose a danger to them. Oh, I forget this does this all this neat little stuff. Advanced personal care services. So let's talk about ostomy. This is where we can clean around the site with soap and water. That is the most that we can do in those areas is that external cleaning with soap and water. With an ostomy, the ostomy itself has to be well healed. So this cannot be somebody who's recently gotten like a feeding tube. If they've recently gotten a feeding tube, we have to wait for the skin around the feeding tube to heal before we're able to do the soap and water. With catheter care, same thing, is soap and water around the site. If it is external catheter, like a condom catheter, we can replace a condom catheter. But if it's an internal catheter, if they're having to do a self-catheterization, we cannot assist with that under this program. That is too invasive to the body, and this program is not meant to be that invasive. Prescribed bowel programs. This is for suppositories, sphincter stimulation, and prepackaged enemas. So this is for somebody who has some kind of a bowel issue, is needing to have some kind of external assistance in order to have that bowel move like it's supposed to. So we can help them with inserting a suppository or even the sphincter stimulation. We will reimburse them for the time to insert the suppository and for the time to help with any cleanup after the suppository has taken effect. But during the wait time for that to happen, the aide will need to be doing something else so that they can get reimbursed for that time frame, because we won't reimburse for them to wait with them for that suppository to take effect. We have application of medication. This is for like prescribed lotions, ointments. It's for dry or aseptic dressings to unbroken skin. When it comes to the skin, once the skin has any break to it at all, it is actually considered a nursing task and cannot be done by the aide that comes in to see them to help with their other care. When we're thinking about this, it's kind of like if they have a rug burn, we could help with putting a dressing on it. But once it's actually broken, there's any bleeding or anything to that area whatsoever, it cannot be done by our aide that comes into the home. So aseptic dressings is the same thing. It can be done by the aide under either application or aseptic dressings, but it's the exact same task. So it just kind of depends on, are we also putting a prescribed lotion onto the area, or are we just replacing that aseptic dressing, which would take it to whichever task that we have there. Passive range of motion. Passive range of motion is to assist somebody who maybe has, maybe they have some paralysis to a joint due to having had a stroke. And we are trying to give them some non-resistant movement of the joint. This is not going to be physical therapy. So we are not actually giving them like exercises that they can do that they can actually offer resistance to. This is really, we are moving the joint for them. We are stretching out the tendons. We are trying to make sure that they maybe maintain a little bit of movement. But once they can offer resistance and it's more physical therapy, we can no longer actually provide that under this program. So under basic personal care, I said when it came to transfers that we could not help with anybody who could not offer and could not provide. Let me try that again. We could not do transfers for anybody who could not bear their own weight. So we couldn't do deadlifts. However, under advanced personal care, if they have an assistive device that helps with those transfers, we can do it under the under assistive transfer devices under advanced personal care. So if they have like a Hoyer lift, maybe they use a gait belt that actually helps with transfers. They have a pivot disc, anything like that, a sliding board, we can do that under advanced personal care. So we can still help them with the transfer, but if it has one of those devices, it has to be done as an APC task. And then we also have medications. With medications, this is non-injectable medications. So we cannot help with injections like, like maybe a vitamin B injection or to take their blood or anything under advanced personal care. But what we can do is help them a little bit more with their medications than we could under basic personal care. Like I said, with basic personal care, they can bring them the medicine, they can help open the bottles, they can pour it into their hands. We can still do that with APC. However, the difference between basic personal care and advanced personal care is under basic for medications, the participant is saying to them, I need to take my medications for today. Can you bring me my pill box? Under advanced personal care, the aide is saying to them, your medications are now due. Want me to bring your pill box to you so you can take them. So we're prompting them to take their medications. It's no longer they're telling us to do it. We are saying this needs to be done. Let's bring this to you. Also, if they have eye drops or ear drops that they need their hands studied for so they can get those drops put into their actual, to hit the target, we can help steady their hand, but we cannot squeeze the bottles. So we can't squeeze eye drops or ear drops. We're just helping them aim it a little bit better. We can also help hold their hands steady for them to do a finger stick if they need to test their blood sugars. And we can let them know what the results of the blood sugar is. But we couldn't do anything else with that task right there. We then have authorized nurse visits. So the nurse can fill insulin syringes and set up medications. They usually do a pill box for 1 week at a time. Sometimes can do 2 weeks if they have the right kind of pill box, but it does base off the pill box. When it comes to the insulin syringes, it is certain medication. There are certain insulins out there that do not, that should not be pre-filled for a week at a time in a plastic insulin syringe. So some doctors will say, no, that insulin, they shouldn't get that pre-filled. So we'll have some limitations on the insulin that we can assist with. Sometimes if the participant really needs it, we'll have the nurse with the agency and the doctor work together to find a better insulin for that participant to make sure that task is done, because the participant really needs somebody to help with that insulin setup. So they can do that, but a lot of insulins, they ask us not to preset them up for more than 3 to 4 days in advance. The nurse will also check for skin breakdown. So if somebody is immobile, they're incontinent, then maybe they have a history of having some kind of bed sores, they have poor circulation, the nurse can check their skin to look for any kind of signs of skin breakdown. Usually we do that once a month. However, if the person has a history of it and there's real concerns of it, we can definitely do it much more often than 1 time a month. It just kind of depends on what their needs are. We also provide nail care. So nail care, when we're doing it because there's a medical need that a nurse does it. If they just need their nails trimmed, that can be done under dressing and grooming. But when it comes to the nurse, if they're diabetic, if they have peripheral vascular disease, if they're on blood thinners, or maybe they have HIV or AIDS, the nurse can do that because they need a little bit more of a specialized care for it than just somebody trimming their nails. So we want to make sure that if they have those conditions, the nurse can do that to keep an eye on the making sure they're not nicking any skin when they're doing it. When somebody has advanced personal care, the nurse has to continue to oversight that nurse. The nurse has to do a monthly evaluation of the aide to make sure that advanced personal care is being done appropriately. So every month the nurse will go in and they'll watch how the task is being done. Because as we know, just because somebody has a Hoyer lift doesn't mean how that Hoyer lift works for them is the same as somebody else. So we need to make sure that the aide is doing it appropriately to how that participant needs that task done. So every month the nurse is going to go in there and make sure that the aide is doing it appropriately, and maybe retraining if retraining is needed for that. And then we have Train APC. We do the training for the APC the first month that we authorize for APC. So when that advanced personal care is first authorized, they'll have 2 nurse visits, one for that training of the APC and another one for the evaluating of the APC. And then we'll have ongoing evaluation done. I will say though, say they have a new aide that's coming in and needs to be trained, or they're really concerned and they need to have some additional training, we can add more training visits on there if it's needed for that individual to get their care. Nurses also for complete general health evaluations. Now, the general health evaluations has to be done for anybody that has basic personal care or advanced personal care authorized. Really, this is so the nurse can see how they're doing. They're doing a full evaluation on them. They're checking the care plan. They're going to let the division know if there's concerns about the care plan. Maybe there needs to be adjustments. They're also going to let us know if the person's doing a lot better and may not need our services anymore. So they're going in there and really looking at how things are going and giving and coming back to us and letting us know if there's changes that need to be made. We also provide other nursing care. So there's a lot of different things that fit under other nursing care. What you see there is not an all-inclusive list, but they will provide those injectable medications. So if they need that B12 injection, or maybe it's somebody who needs to have their blood drawn to check how their blood, how the blood thinners they're on are working. They can do those catheter changes, those internal catheter changes. How I mentioned under advanced personal care, we could do prepackaged enemas for the bowel programs, and the nurse can do enemas where they have to mix up the ingredients for that enema. They're the ones who help with that wound dressing changes. Now, we expect home health to do wound dressing changes for most individuals, but sometimes home health has pulled out for one reason or another, and our nurse might pick it up for the remainder of that time. And then, there's all kinds of things the nurse can do, and we just have to make sure that we don't exceed the 26 visits in a 6-month period that we can authorize for the nurse. So we have to look at that, but there's a lot of different things that we can do under the other nursing care. So we also provide assistance in residential care facilities, assisted living facilities, the RCFs, ALFs. What we're providing to them is services that's above and beyond the facility's contractual agreement. So most facilities have an agreement to clean the room once a month, once a week. They also provide 3 meals a day. But then if we have somebody who, for example, needs help with bathing, that's not part of their contract to help somebody with bathing. So we can actually provide some supplemental money to the RCF for them to pay their aide to help somebody to bathe. We're not sending somebody into the facility. This is the facility staff themselves that are providing these services, but they're providing the exact same kind of care that we're doing in the home in that facility, and we're just reimbursing for their staff to do that. That hopefully that will allow those RCFs to keep their doors open, because they're getting some money to help pay their aides to take care of all of the services that the participant needs. It looks exactly like what we provide to them in home. It's just in the facilities. It's the exact same type of services. And then we have our consumer directed services. So in order for somebody to qualify for consumer directed services, they have to be able to supervise their attendant. They have to verify their wages, use EVV. They have to let us know if there's changes, and they have to be able to report problems. Generally, when I'm talking about consumer directed services and I talk about the ability to self-direct, what I say is the participant has to be able to run a small business. That is everything that's required of somebody who runs a small business, including they have to have an employee identification number through IRS for taxes. So they are a small business, and they have to do everything that comes upon that. They have to be able to hire and fire, interview people. All of that comes with that. The other thing too, when it comes to the consumer directed services, they do have to be considered physically disabled. Our definition of physically disabled, though, basically says that if the participant has a diagnosis of any kind that it limits their ability to complete their activities of daily living, we consider that to be physically disabled. So it could be somebody who has some paralysis that affects them. It could be somebody who has depression, that because of depression, they can't get out of bed and it affects their ability to meet their activities of daily living. We look at and use all of those as a basis on what's considered physically disabled. Everything I talked about when it came to personal care and advanced personal care is provided under personal care assistance. So we provide all of those same services to them. The big difference is under agency model services, they have to, the agency is training the aide on how to provide these services. Under consumer directed services, the participant is required to train the attendant on completing these services. So the consumer is responsible for that training element. So if they're doing a catheter hygiene, the participant has trained them on how to do that catheter hygiene for them. So let's talk a little bit about our waivers. In order to be in our waivers, you can only have one waiver at a time. We have 6 waivers in our division. We have the AIDS waiver is also in our department. And then Department of Mental Health has 4 waivers. So regardless of who oversees that waiver, you can only be enrolled in one waiver at a time. All of our waivers underneath under my overseeing, you have to meet nursing facility level of care. And once again, you have to have that active Medicaid with that appropriate ME code, just making sure that they can get reimbursed for the services they're providing. They also have to be a Missouri resident. So the first waiver I'm going to talk about is age and disabled waiver. This got a little bit of a difference of an eligibility requirement because you do have to be over the age of 63 to qualify. So that's a little bit different. Other waivers, you just have to, other services, you have to be 18, but this is 63. And what we provide under the age and disabled waiver, we provide homemaker, which is the meals, the dishes, the cleaning the kitchen, all of those cleaning tasks to keep somebody's home clean. Just remember, this is not a white glove cleaning. This is cleaning to like make sure if somebody's there for like Section 8 housing that they aren't going to get evicted because their home isn't clean enough. So we are making sure that we meet those basic criteria, but we're not doing a white glove. So we're not moving furniture. They're not climbing up on a chair to clean a ceiling fan or to clean the walls real high, even to clean the windows. We expect that they're doing cleaning flat-footed, where the highest they reach is whatever their arm is going to get for them to clean, but they're not going to go any higher than that. We don't want to put the aides in any kind of danger by having them climbing up on anything or moving anything. Chore service. So this is more in-depth cleaning. This is not something we do on a regular basis. Think about maybe somebody who's a hoarder who's like, yeah, I really need to get my house cleaned. We will go in there and we will help them. We will help clean out closets, clean out basements and attics, maybe shampoo the rugs, clean air mattresses, spray for insects, or, for insects, or provide rodent control. Maybe somebody's been in the hospital for a long period of time and they come home and the house, because of being sick, it's just really dirty. We'll maybe spend 3 hours, 3 days a week for like a month to go in there and clean. It's going to be very short term. As we know, when it comes to like insects or rodent control, just one-time treatment usually doesn't help. So we could do it on a quarterly basis. As long as they're doing what they need to in between, we could go in there and do that spray for the insects and provide the rodent control. The only thing to remember with this is, first of all, they have to supply anything that we need to do it. Second, if there is a landlord involved and their landlord is responsible for that insect control, we would not do it in place of them. They would have to do that stuff. We also provide home delivered meals. So this is 1 or 2 meals per day. They can get them up to 7 days a week. So they can get up to 62 meals a day, 62 meals, 62 meals a month. They're going to each give them about 1/3 of the recommended daily nutritional requirements. So it is, it's trying to be nutritional for them. They don't generally provide them with any kind of dietary restriction. So if somebody's diabetic, they're not necessarily going to get a diabetic meal out of here. This is being done in bulk, usually by the senior centers. We contract with the area on aging agencies, and then they contract with the senior centers to actually get the food out. So it's kind of how that senior center runs. If there's somebody who gets 62 meals, they may get 5 hot meals during the week, and then all of the rest of their meals might be frozen meals. So it just kind of depends on how it runs in that area. We provide respite. This is for supervision, companionship, and direct participant assistance. When we're talking about direct participant assistance, we mean if they have an accident, we need to clean them up. If they need some water, we need to bring them water. If they have, like, they need a bath every single day, something like that, we will make sure we authorize personal care services and not respite for them to be providing that. We have the adult daycare services. Now, this is for individuals over the age 63. So I'm not going to go into a lot of detail because I'm going to talk about the adult daycare waiver. Ooh, tongue twister. That's the exact same service as this, but this is but it's 18 to 63. So when it comes to the adult daycare waiver, this is 18 to 63. And then the age and disabled waiver has the exact same program for 63 and older. And basically, this is continuous care and supervision in a licensed adult daycare setting. They provide them all kinds of things, activities of daily living. They have lunch for them. They have group activities. I'm here in Kansas City, so I have seen daycares take their individuals to bowling, to see movies, to go to Walmart, to do shopping. So they have planned things for them to do. It's a lot for social interaction. They don't have a very their limit on how many staff they need towards participants that are there are kind of they're kind of like, I think it's like 1 to every 8, something similar to that. So if we have somebody who has dementia or Alzheimer's or another diagnosis that will make them wander out of the facility, most of our daycares may not be the best option for them because the doors are going to be open. There's not going to be somebody watching who's coming and going. So somebody could actually get out the doors and get lost. So we do have to be very careful about where we place individuals to make sure that if there is one that has those kind of concerns, that we find a facility that can actually provide them with that higher oversight. They have to have that nursing home level of care, that active Medicaid. They get 5 days, they can get up 5 days a week, up to 10 hours a day. So it's a total of 50 hours a week. 2 hours a day can help with transportation to and from the facility. Daycares are responsible to provide the transportation back and forth. So they're the ones who have to actually provide that transportation. Now that could be mom's going to drop her son off on the way to work, and that's okay, as long as they've arranged what that transportation is going to look like. Then I have the independent living waiver. So this is talking about individuals who have like consumer directed services. They may need an additional services beyond that. So if they have that personal care assistance through consumer directed services, there is a limit on how much time they can get. This allows them to go over that limit. However, they can also get the other services that we provide under the independent living waiver, independent of those personal care assistants. So to qualify for the independent living waiver, they're between the ages of 18 to 64. If they've turned 65, they can remain in the program as long as they are still able to self-direct and they want to continue with the program. They may say, I'm done with this. I don't want to do this anymore. But once they've come out of the program and are older than 65, they cannot come back into the program. They have to have that ability to self-direct, just like in consumer directed services. They have to be physically disabled, and they have to have that nursing home level of care with the right kind of Medicaid. We have different services that we provide under the IL waiver. We have the personal care assistance, which is the same as what we provide under consumer directed services. We have financial management services. What they're helping with there is making sure that the aide's background check has been done, that the aide is getting, that the attendant is getting paid, and they're making sure those kinds of administrative type things are being done. They have case management. So once a month, the case manager is going to call the participant and talk to them. They're going to make sure that they're getting all the services that they need, that their care plan is working okay, that they're working well with their attendant. Maybe there needs to be a change made to their attendant. They're seeing more to that social aspect of what that individual may need, and make sure that all of those social things are being taken care of for them. We have specialized medical equipment. Specialized medical equipment, we do have a limit on that of $5,000 in a 5-year period. Generally, when I talk about specialized medical equipment, I think of durable medical equipment. So they have to have, it's those hospital beds, wheelchairs, anything like that, that's a durable medical equipment. We can see if it can be authorized under specialized medical equipment. Now, this is a payer of last resort. So they have to have gotten denied from other areas before we can look to see if we can help them with this program, but we can definitely look at it if they qualify. Then we have specialized medical supplies. Those are incontinency supplies. So Depends, wipes, diapers, bed pads, those kinds of things. There's the same things that are going to get paid through Medicaid as well. Their program that they have. So if they are getting it through that program, they would not get it through our independent living waiver. And then we have environmental accessibility adaptations. It also has a limit of $5,000 in a 5-year period. This is where we can do some modifications to the home to help that person meet their activities of daily living. So this is not just a wearing down of something, like we can't do roofs or a water tank or an air conditioner. We really need to do it so that they can lessen their dependency upon somebody else. So always using the example, the carpet's really worn down. They can't get through the carpet because the carpet is so worn down. They have to have somebody who pushes them from one place to another. We remove the carpet, put hardwood floors down, and now they can move around the home without that assistance. That's what we're looking at when we're doing home modifications. Newest waiver that we have is our structured family caregiver waiver. So this is for individuals who have been diagnosed with Alzheimer's or dementia. They're over the age of 21. They are living with their caregiver, the person who's actually going to get reimbursed for their care, that they're living with them. They have to have a backup caregiver. That's so that if the living caregiver needs to step out of the home, there's somebody else already keyed up to go into the home to care for them. And of course, they have to meet nursing home level of care and have that active Medicaid. This program in itself is a 24-hour inclusive program. We will do it's a daily per diem that we are providing to the caregiver, and they're overseeing everything within the scope of our program. Like if there actually needs to be medication set up, that's not going to be something that we are going to allow during our time in the program. But maybe the provider will send a nurse out to set up their medications depending on what the circumstances are. But this is an all-inclusive. There are no other services provided by us except for that 24-hour assistance to the participant through their caregiver. And then we have the adult brain injury waiver. So this is also a newer one. This is for somebody who has medical documentation of a traumatic brain injury. So they've had some kind of traumatic brain injury. When we're talking traumatic brain injury, we're meaning like they've if something resulted from a car accident or fall, or a maybe they had gunshot wound, some kind of an injury to them. It's not the same as an anoxic brain injury. Anoxic brain injuries occur when somebody has a stroke, or maybe they have had some kind of a drug overdose. So it is different, and we do have to have medical documentation of it. This program is for individuals between the ages of 21 to 65, with also they have to have Medicaid, and they also have to meet nursing home level of care. This program runs a little bit different for us. There are 2 service coordinators that provide assistance to any of our participants in the state with a brain injury waiver. Right now, this program has about 25 people in it, so it doesn't have a lot of individuals in it. The service coordinators, they are case managers, so they're evaluating and assessing their needs, their monthly contacts with them, they're providing that family support. They're doing a lot of transition planning with them. Then we have the other side, which is the rehab services. So this is where we're coming in and really helping them with the care as much as we can. So we're providing them with therapy, speech therapy, physical therapy, occupational therapy. We're providing them with assistive technology. We're also doing some environmental accessibility modifications. So the assistive technology and the home modifications, they both have limits. And those limits are $5,000, but that's an annual limit. So if we have somebody who needs some home modifications done and it's $7,000, what we'll do is we'll move it towards the end of the waiver year, and we'll spend the $5,000, and then we'll spend the rest of it right over the next of the waiver year. So that way they can actually get that a little bit more of expensive care home modification done. But we have all kinds of different things. This is a really great program. We did just increase our slots to 40. So if anybody is aware of anybody who might need assistance through this program, please let us know, because this is a program that I think is very underused. And then the other one that I want to talk about is not actually a slide that I have, and it's for the medically fragile adult waiver. A medically fragile adult waiver is for individuals over the age of 21 who need 4 continuous hours of private duty nursing. So a lot of times our individuals come from our Healthy Children and Youth program, and they go into our medically fragile adult waiver. It provides them with that private duty nursing that they need, and it also provides them with any state plan type services that they have as well. But they do, like I said, they have to have medical documentation that they needed 4 continuous hours of private duty nursing before the age of 21 to qualify. Okay, and there is that. So what all questions did we have? Okay, so structured family caregiver waiver. So does the worker go through the full in-home training, including the on-the-job training sessions? No. That training for structured family is dedicated to what the care for that individual is. So there is still training that is done. They have to do the orientation training for the provider, but the actual orientation training that you see happening does not happen with them. They just train towards the needs of the person that they're caring for. Can the TBI happen at any age to be eligible? Yes. Yeah. If they're under the age of 21, though, we're going to recommend that they go to DMH, Department of Mental Health, to see if they can meet their needs first, because they do have a lot of more Robux type. DMH has a lot more Robux type services. So we would see if they could qualify for DMH services before we would put them into our waiver. Under the brain injury waiver, are day program services available? No, unfortunately, they are not. We do not have any day programs under the brain injury waiver. Okay, so what is the process to refer a client, explore a waiver? We often refer to in-home state plan hours, but there's a separate process to explore a waiver through, no. If you refer somebody for in-home services, they are going to evaluate them for waiver services at the same time. We're all the same organization. And so the person who goes in and does the assessment for state plan knows about all of our waivers and will be seeing if they're available for any of our waivers as well. Okay, so the 4 DMH waivers, and actually what I'll do, because I know about them. There's the community waiver, there's the Hope waiver, there's the Missouri Children's waiver, and I always forget the other fourth one, but I'm gonna stop sharing and I'm gonna find it real quick. Okay, what else do we have? What division of DHS are these waivers offered through? Is it various divisions, including HCY? So HCY and special health care needs, HCY and medically fragile adult waiver is operated through special health care needs. So they're the Bureau of Special Health Care Needs. They're the ones who run those two. And then the other waivers, the 5 that I just talked about in the state plan, that's through the Division of Senior and Disability Services. And then the AIDS waiver is through Division of Community and Public Health. So, but the special healthcare needs is also with DSDS. So DSDS, we run all those together, but AIDS waiver is under Division of Community and Public Health. They run that with the Ryan White program. Do potential structured family have to meet the same income limits to obtain Medicaid? Yes. Yes, they have to have the same income limits as anybody else to meet Medicaid. All of them do. Where do we go for evaluation for waiver service? Like I said, if you know how to refer for the state plan services, it's the same process for our waiver services. There's not a different evaluation for it. Yes, and I see a lot of people are saying it's the comprehensive waiver. Comprehensive, the community, the Hope waiver, and the Missouri Children. In general, what are the criteria for a person to meet a nursing facility level of care? So our assessment is going to look at what kind of assistance does somebody need. So we're looking at, okay, they have medications. What kind of help do they need to meet to get those medications? If they need help, if they have bathing, what kind of help do they need with bathing? So it's really looking at what they need. So we're looking at their personal care, bathing, we're looking at eating, we're looking at like their safety, how safe are they doing certain activities? We're looking at their cognition. So do they have some, maybe they have some dementia. There we have 12 different categories that we're looking at now. And Jana, I see you on here. Let me see if I can pull that slide up real quick. So will the state determine what waiver someone qualifies for or how we request each type of waiver? When we go out and do an assessment for somebody, we're going to determine what type of waiver they may qualify for. So we will talk to them about all of the different services that is available to them and let them determine which service that they want. So it's all part of that assessment process that we have, the assessment and the person-centered care planning process that we go through. We work with them and help them determine what's going to best meet their needs. Does the $5,000 cover multiple things with a 5,000 limit or just one event service item? It depends. Right now, because of inflation, $5,000 is not covering very much. But if it doesn't cover 5,000, we can definitely buy more than one thing. So it's not limited to one event. But once that $5,000 is expended, we cannot expend any more money. And I see somebody was nice enough to send us the link for the DMH waivers. I appreciate that very much. Is there a waiver that can do feeding tubes? So the only waiver that can do feeding tubes would be a waiver that had private duty nursing. None of our waivers can do feeding tubes. So we are not able to do that with any of our services. But private duty nursing, they have a little more flexibility with those things. Can a structured family recipient receive structured family and CDS? No, they cannot. When somebody is authorized for structured family services, that is the only service they are authorized for. They cannot receive anything else. And except for, I was going to see if I can find that slide that talked about level of care real quick. Hey, Jana, I know you're on here. Can you talk a little bit about the referral process for individuals who don't know real quick?
Yes. So the referral process, you mean like don't know if they qualify for services or not?
Well, just, you know, how they send in the referral, but the avenues that they can send it into.
Yeah. So we do have on our provider webpage, we have that outlined as well, but we have the online submission form, which I can I'll put that in the chat below as well. And you can go online and anybody can do that. Rather, we encourage providers to do that to keep our phone lines open. But anyone can go online and make a referral or request. A request is a change for services, and referrals are for somebody that is new to services. We also have a toll-free number for our participants and their family to contact, and you can make referrals online through the phone from 8:30 to 3 o'clock Monday through Friday. We are closed on state holidays and the weekends. And I will put that information in the chat as well.
So as I'm still looking, I see, is there a question about, is private duty nursing the same thing as authorized nurse visits? And that's no. Private duty nursing is they're actually able to provide services that are beyond what we can do, like wound care, trach care, suctioning, those kinds of things. So it is very different than what our authorized nurse visits are. Is dementia the only diagnosis that works for structured family, or is it flexible? So the statute says Alzheimer's or dementia related. So we do have to determine if the diagnosis is related to dementia in order for us to be able to approve it. So sometimes we have to do some research and we have to hear from the doctor to let us know, is the diagnosis related to dementia or not? How we receive private duty nursing services. So if the individual needed private duty nursing services, are under the age of 21 or needed it before the age of 21, then you can reach out to Special Healthcare Needs to see if they could qualify for either their Healthy Children and Youth or their medically fragile adult waiver. Or and I don't know besides that, and I know that Glenda's on here, but I know that she's also not able to talk. So I don't know, Glenda, if you could send a message saying if there's another way for somebody to get private duty nursing that you're aware of. If you have an individual in the home who has autism, you can definitely reach out to the Department of Mental Health about seeing if they qualify for services through them. You can also look to see if they qualify for any services through our division as well, because you know, if you don't have the diagnosis at the right time, or they don't have the right kind of services that you would be interested in for him, we can definitely look to see if there's anything he qualifies through our division. Okay, so Glenda says the only way for somebody to get private duty nursing is, like I said, through Healthy Children and Youth or the medically fragile adult waiver. Is the referral for statewide referrals or just Northwest Missouri? The referrals for statewide. Who should I call about autism? So on the DMH waiver site, I think the one they provided us, oh no, this is the program model. Jana, can you pull the site for DMH referrals? Okay, for private duty nursing, what if the child does not have Medicaid? Is there any resources? Not that I'm aware of. Yeah, and that's true. All DMH waivers are on a wait list status at this time. I will say our waivers are not, but currently DMH waivers are on a wait list.
Perfect. Rena and Jana, thank you so much for sharing all of this great information. There were a lot of questions that came in chat. We have one more, and then we will wrap up for this afternoon for the sake of time to ensure that everyone's out on time. Someone asked, can you have a DMH waiver and a DSDS waiver at the same time?
No, you cannot. You can have one or the other, but not both. And also I would say that we got a note on here about encouraging for support coordination for DMH. Yes, please do. I know they may have a wait list for their waivers, but it's very important to go ahead and get yourself on that support coordination, and that way they can start helping you with maybe some other things as well. So don't let their wait list status deter you from reaching out to DMH.
Thank you. And just as a reminder to everyone on this call, you will receive a follow-up email from Angelina at the email address that you registered for this webinar at. It will include the slides. It will include the video. These will also be posted to the YouTube channel. If you want to share those with others, we encourage you to do so that everyone gets a chance to learn this great information. And we'd like to thank our speakers again for lending their time and experience to educate the rest of us. Thank you.